ممتاز. على بركة الله. طيب. One of the also very common test and question is about bleeding disorders والcoagulation profile والأشياء هذه. So hopefully you guys are going to get more familiar with the test and how to approach it and how to work up an abnormal test finding. Okay? So before going into details, ودنا بس نراجع شوي الهيموستاسيس لأنه أعتقد إنه good to have a little bit of good background about it before today lecture. Okay? So as you guys know, أنا بحط هذه كذا شوي هنا, but I will pay attention to the details إن شاء الله إذا جت. Okay. So hemostasis, وش قصدنا بهيموستاسيس؟ Hemostasis is a process. هو يعني حركة within the vessels in which bleeding can be controlled at the site of damaged vascular endothelium. فإذا عندنا damage بالvascular endothelium, the process to stop this bleeding, we call it hemostasis. Okay? It's a kind of internal patch زي اللي نحطه ذا بالجلد اللي هو الأيد وما الأيد هو بالضبط there is actually internal patch resembling that, okay? But it's a really fine dynamic interplay between أول شيء subendothelium, الendothelium, a circulating cell, as well as the plasma protein, okay? And this is just يعني على قولتهم illustration of what's happened over there. So for example, when you start to have a bleeding, there's going to be أول شيء كده vascular spasm, كده زي الcontraction موجود. ثم تبدأ البليتلت blood formation. platelet تبدأ تيجي وتحاول تغلق المكان هذا. ثم الcoagulation يبدأ وعندك الcoagulation pathway طبعا تعرفونه الانترنسيك والاكسترنسيك. So it's a very fine consequential phases to try to stop the bleed. Okay? In general, we can categorize hemostasis to primary and secondary. Primary basically, the final result هو formation of platelet blood. Okay? بينما secondary هو اللي يكون عندك formation of stable fibrin clot. So it's rely heavily على plasma coagulation. Okay? Okay. So what's the importance of the medical history here? Okay? Well, you always can take information regarding bleeding symptoms, which include location, yani, is it nasal, is it gum bleeding, is it with the menstrual cycle, how often this has happened, when it's happened, how long it's last, متى بدأ, what's the age of onset, is it during childhood, is it during adolescent, is it during adulthood, and the time required for cessation, how long it's lasted for. Okay? ليش هذه المعلومات مهمة؟ لأنه platelets, in the primary, usually they will experience what we call it mucocutaneous bleeding. So something in the mucus, like the gum, ولا something in the skin, cutaneous, okay? It's including easy bruising, epistaxis, heavy menstrual cycle, and this is usually contributed to the platelet or von Willebrand. A second type is the deep bleeding, hemoarthrosis, or muscle hematoma. هذول can be actually from the plasma protein, okay? So obtaining a detailed history and family history is crucial. حتى family history is very, very crucial, as well as the laboratory testing, okay? Current use of medication, as well as herbal medication. الأدوية الشعبية هذه مهم الواحد يسأل عنها when it comes to the bleeding history, okay? And also one of the good history taking is asking about what we call it hemostatic challenge. يعني لما الواحد يروح العملية what happened after? We challenge their hemostasis, something like surgery when they went for their appendectomy or gallbladder removal. Did their surgeon mention that they kept bleeding and they didn't stop of bleeding? Did they lose blood more than the average and require blood transfusion? Also dental procedure, when they go to their dentist, that they bleed a lot, okay? Especially when they remove, for example, a teeth, as well as when they have a trauma, that they result of major bleeding more than expected, as well as the menstrual history in female. To be objective, this is very busy slide, but had one of the assessments created by an international group, just to know whether the bleeding is significant or not, okay? We're not gonna go over it, you can go over it in your free time. But for example, when you have, for example, cutaneous symptoms, okay? Is it يعني مرة simple, just trivia, ولا it's actually bruising, يعني more than 1 centimeter? Is it required, did it require consultation الهيماتولogist؟ هذا يعتبرونه 2 point in the score. Was it extensive, يعني all over their body? Was it end up leading to blood transfusion? هذا 4. So we are trying to be نحول الهيستوري اللي can be very subjective to something more objective, okay? The cutoff to call it normal is more than 3 is abnormal in men and more than 5 is abnormal for women. Okay. This is too early. I don't know why I put yes. This is the coagulation of PT and APTT. Look at, sometimes the history is still, sometimes the history is still you a lot. So for example, if someone is having heparin overdose, you calculate their need and they are actually taking more than they require when it comes to the heparin. So expect some prolongation in PT and APTT, okay? If someone is they actually in heparin, this is only by the history, only by reviewing medication, expect prolonged in the PT. If you have someone with liver disease, for example, expect some prolongation in PT, بينما normal PTT. So the history can tell you a lot, and we're going to go over this in detail, inshallah. الفرق بين الباتيكياي والبيربرا is the size. الباتيكياي is very small, and purpura is larger, and we have here ecchymosis. Laboratory tests, well, prothrombin, اللي هو نسميه PT, as well as the activated partial thromboplastin time, APTT. Those are very common order. PT expressed as INR, just to have a standardized numbers internationally. So, and it's very sensitive to the effect of vitamin K dependent factor, L22, 7, and 10, where APTT is more sensitive measurement of factor 8, 9, 11, and 12. Hello? Basically, we have it, I think, in one of the slides. PT is more for the extrinsic, PTT is more for the intrinsic factor, okay? We also have what we call thrombin time. It's not as common as the PT and the APTT. So thrombin time is basically measure fibrinogen conversion to fibrin clot. We also have the platelet function analyzer. واضح من اسمه إنه يقيس platelet function. And mixing study, we're going to talk about it in details, as well as we have اللي هو D-dimer, as well as the fibrin degradation products. Let's jump to the case number 1. 44-year-old male with history of sleeve gastrectomy 1 year ago. Now have unbearable GERD. عنده كده GERD سيء, and the surgeon is planning to do a gastric bypass. His pre-op workup showed prolonged PT and APTT in his coagulation profile. I don't know why I kept saying her. So how would you approach this case? So far in the pre-op workup, they have prolonged PT and APTT in their coagulation, okay? So again, this is the coagulation cascade you guys are very familiar with, hopefully by now. This is the extrinsic, this is the intrinsic. And لاحظوا إنه extrinsic and the intrinsic are actually meeting in factor 10, factor 5, as well as factor 2, اللي هو prothrombin, and factor 1, اللي هو fibrinogen, okay? So when you have someone with prolonged PT and APTT, always think about those mutual factors, because it's in the extrinsic as well as it's in the intrinsic pathway. Okay, so when you have combined abnormal PT and APTT, think about deficiencies or inhibition of the factor in the common pathway. We talked about those, as well as lupus anticoagulants can lead to this combined prolongation of PT and APTT, advanced liver disease, vitamin K deficiency, as well as malnutrition. So هذول يعني when you have prolongation in PT and APTT, those are your differential diagnosis. Okay, so the clinical context was very highly suggestive of vitamin K deficiency, given that they have severe GERD, unable to eat that much. Vitamin K trial was given for her. All the coagulation abnormality improved after that. Okay. Okay. I know you have a lot of questions, but you will see the pattern shortly about how to approach those cases. Okay. Okay. 28-year-old pregnant with planned elective C-section as her baby is breech. Her pre-op coagulation profile showed an isolated prolonged APTT. How would you approach this case? Well, whenever we have an isolated, whether APTT or PT, we go with what we call it a mixing study. Hold that thought for 1 second. I'm going to explain in a very simple language what mixing study is. A mixing study, guys, they take a patient blood, hello, and they mix it with normal individual blood. Okay? طيب. There is two potential outcome out of that. خلنا نقول البيشنت هذا خلنا نسميه رقم 1 عنده antibodies against الفactors. عنده antibodies against the factor. So when you mix it with the normal plasma or normal blood, الantibodies still going to attack هذه البروتين اللي هو الفactors, and the result is the same. He will remain having prolonged APTT. Okay? لأنه الantibodies went to attack the new coagulation factors. Okay? Compare this to someone, they have deficiencies. ما عندهم الفactors. Okay? You mix it with a normal blood or plasma, and results, they will have corrected coagulation profile. Guys, is this clear? الميكسينج study ودي انكم تفهمونها صح لانها تريحكم very much understanding coagulation and how to approach them. Is this clear, guys? Guys, is this clear? شكلكم ما رجعتوا من البريك. شباب, الميكسينج study easy. أعيدها أبشر لأنه مهمة جدا جدا فهمها. الحين بحاول حتى أعيدها شوي بالعربي يعني ممكن تفهم أسهل. الحين خلنا ناخذ أول شيء الأسهل. واحد عنده deficiency, ما عنده factor, certain factor. خلنا نقول ما عنده factor 7. Their body they cannot produce factor 7. ما عنده factor 7. أخذت الدم حقه ويو ميكس ات مع شخص طبيعي، الشخص الطبيعي هذا عنده الفاكتور 7، هذا تشوف هذه النقط الزرقاء هذه فاكتور 7. لما يعيدون التست يبي يصير الكلوتينج تايمز نورمالايز، لانه صار عندهم الميكسينج النيو ميكس هذا صار في فاكتور 7، فالريزلت طلعت نورمال. حلو؟ يعني بمعنى هذا البيشنت لما تسوي له الكواجوليشن بيكون ابنورمال، بيكون برولونج. لما تسوي للنورمال نورمال بيصير طبيعي. لما تسوي للميكس بيصير كوركشن. الميكس الجديد هذا كوركشن، كان ابنورمال عند البيشنت والحين صار كوركتد. هذا اذا عندك ديفيشنسي. اذا عندك مشكله بالانتي بوديز، عندك انهبيتورز، الانتي بوديز ذولي بيروحون وقنا اتاك بيروحون اتاك الفاكتورز هذه، فالنتيجه هي نفسها. الانتي بوديز قنا اتاك النيو بلود والريزلت still gonna show prolonged coagulation. واضحه؟ طيب فنرجع للمريضه هذه، نسوي الاي بي تي تي، اوكي، ونشوف if it is corrected that's meaning she have deficiency. If it wasn't corrected we do what we call it lupus anticoagulant. هذه one of the inhibitors, one of the antibodies. If it is positive that's meaning she have lupus anticoagulant. If it is negative maybe she have inhibitors to specific factors like factor 8, factor 9, factor 11. Why we are focusing on those factors? Because those are the intrinsic factors pathway. Okay? طيب نرجع للكيس. Mixing study was done, revealed no correction. So وش معناه no correction؟ معناته she have some sort of inhibition, some sort of antibodies. Okay? وبعدين after that we did a lupus anticoagulant. Her lupus anticoagulant turned to be positive. So basically she have lupus anticoagulant led to prolonged APTT. واضحة يا شباب؟ طيب ناخذ الكيس 3. 58-year-old male with history of alcohol consumption presented with hematemesis and melena. His coagulation profile showed an isolated prolonged PT. He is not taking warfarin. That's very important information. How would you approach this coagulation abnormality? Again, the same. When you have isolated PT, you go with the mixing study, okay? The same concept. When it's corrected, that's meaning they have basically deficiency. When it's not corrected, you think about inhibitors like lupus or specific inhibitors for factor 7, for example, okay? Okay. Kindly remember that a PT is basically assessing 3 out of the 4 vitamin K dependent factors. So prothrombin assessing for factor 2, 7, and factor 10, okay? As well as factor طبعا 5 and fibrinogen. هذا كله من الفسيولوجي, okay? And I will mention why we are talking about that now, okay? So his isolated prolonged PT was corrected in the mixing study. So that's meaning he has some sort of deficiency. You confirm your suspicion of factor 7 deficiency by measuring it, and the patient was treated with vitamin K with partial improvement in their coagulation profile. Okay? Is this clear, guys? Steps. يعني فعلا the most important step to understand is this so far. لأنه it will tell you whether this is inhibitor اللي هم هنا ولا deficiencies, and you can confirm your suspicion by measuring the factors if you want. طيب هذه word of wisdom من دكتور موسى الزهراني, one of the hematologists, إنه ال INR, it's really, يعني if you're gonna remember what's the INR, you should link it only to the warfarin. بس ال INR idea is to monitor the warfarin and to adjust the warfarin dose. It's not meant to assess the coagulation. It's not meant to assess the hemostasis. It's not meant to assess الدواء اللي هو direct oral anticoagulant medication. It's only for the warfarin. PT and PTT, yes, you can assess the coagulopathy, the hemostasis, as well as a bleeding disorder. Okay? Okay, so case number 4, guys. 24-year-old female, healthy, was rushed to emergency after becoming comatose. Her CT head showed intracranial bleeding, had an immediate neurosurgical intervention. Her workup aftermath showed a prolonged APTT that failed to fully correct after a mixing study. What's next? What are we thinking about so far? واحدة عندها prolonged APTT is not corrected with a mixing study. What shall we think about? Or what's the next step? ها يا شباب واضحة والله. خلنا بعطيكم السلايد اللي ممكن يوضحه. So she have prolonged PTT. You did the mixing study, it wasn't correct. So now it's the time to do lupus anticoagulants. Okay? So for her, lupus anticoagulant was negative. So if the lupus anticoagulant is negative, we do the rest of the assays. You can see it here. Okay? So we measure the antibodies against factor 8, 9, and 11. Okay? In this case, when it's measured, basically it showed acquired hemophilia A. What's hemophilia, guys? ما هي الهيموفيليا? And what's hemophilia A? What factors get affected by hemophilia? Eight, أحسنت, yes. So usually hemophilia, a congenital one, is usually male disorder because it's affecting the X chromosome, but also female, they can have an acquired hemophilia A. Acquired hemophilia A معناته an antibody against factor 8. And factor 8, one of the intrinsic factors. Okay? Any questions so far, guys? Is the approach to PT and APTT now is more clear, guys? Hopefully. يعني if you master السلايد هذه اللي هو البي تي ونفس الابروتش مقارب للاي بي تي تي اوكي and you remember this, you're gonna be in a very good shape. فعلا بيصير عندك الفاونديشن of approaching to bleeding disorder gonna be very, very good. If you, of course, understand also the physiology as well as the concept of a mixing study. Okay, so let's go to the next case and probably switching gears to platelet disorder. Okay, so 36, female, had a prolonged history of easy bruising and heavy menstrual cycle, but never sought any medical attention before. Now she presented to the emergency department with epistaxis. Her initial workup showed the following. So you clearly can see that the platelets are low. So she have thrombocytopenia, okay? Okay, so her nosebleed stopped after cauterization. How would you proceed investigating this case? Well, the approach to thrombocytopenia is as of the following. The first, we look at the smear, okay? ليش we look at the smear? Because a lot of the times, although the lab reporting low platelets, in fact, the platelets are clumping, aggregating. So that's meaning this is a false thrombocytopenia, okay? But let's say they look at the smear and it was found to be a true thrombocytopenia. فعلا, the smear, بالفيلم, there was low platelet count, like they counted manually, okay? Then it will be helpful to see what's other finding in the smear. Is there any schistocyte? If there is any schistocyte, we should think about TTP and HUS and DIC. We just talked about that in the previous lecture. Is there any blast? A blast may indicate leukemia, okay? Is there any actually microspherocytosis and RBC clumping? So we will consider something like Evans syndrome, like hemolysis and thrombocytopenia. Is there any actually lymphocytosis or atypical lymphocyte? So we can consider infection like virus like CMV and EBV. But if all these are negative, and this is all based on the blood film and smear, we can call it isolated thrombocytopenia. And for the isolated thrombocytopenia, to call someone ITP, not isolated thrombocytopenia, ITP, immunothrombocytopenia, we have to do the proper workup, which are these, okay? So we do liver function test, thyroid function test, immunoglobulin, direct antiglobulin, Coombs test, antiphospholipid, ANA, H. pylori, HIV, HCV, HBV, because we said in the previous lecture, ITP, it's a diagnosis of exclusion. So we have to exclude all other disease to call someone having ITP, okay? So all the workup turned to be negative. You diagnosed it with ITP. We talked about the ITP management in the previous lecture, whether steroid, first line, as well as IV, IG, if you like to bring the platelet counts faster, okay? So question, guys. What do you think is the most common inherited bleeding disorder? أعطونا تخمينات. What is the most common inherited bleeding disorder? Hemophilia, good guess. It's actually, guys, von Willebrand disease, okay? So some of the nation and geographic location have up to 1 in 100, and 1% per population. Crazy. That's meaning it's a very common disorder, okay? And we can actually categorize into quantitative and qualitative. Quantitative mean basically a number is low. Qualitative meaning an effect or a function is defective. Okay, So what is von Willebrand factor? Well, has two rules really. One, promote a platelet adhesion to exposed subendothelium. So it's kind of middleman between the platelet and the endothelium. The second is serve as a chaperone for factor 8, protecting it from proteolytic degradation. Okay, so always accompanied factor 8. Okay, okay. So those are the types of von Willebrand. يعني a lot of classification. We don't expect you to know them all, بس خلينا نشوف tables and what's the striking feature in the table, okay? A lot of the types are actually related to the platelet, and one of its functions is actually helping the platelet for aggregation, okay? Sorry. So you see a lot of its function related to platelets, okay? هذول الاشياء طبعا اللي هو how to measure an activity of von Willebrand, but also what's the factor 8 level, okay? طيب. Types, type 1, type 2, type 3. Type 1, basically, it's a kind of qualitative, okay? بس also بعضهم quantitative. يعني هذا صراحة too much for you guys. بس يعني I would say, for example, remember إنه common disorder, whenever you are in doubt, always refer to a specialist if you think about von Willebrand, for example. And remember that it's heavily linked to factor 8. So when you have a factor 8 abnormality, look for von Willebrand abnormality. Okay? Okay. Let me see. طيب خلينا نقول let's take things يعني من as simple as someone just walking with bleeding disorder. Okay? How to approach them. At first, بالclinic, really try to see whether they have trauma or medication can explain this bleeding disorder. لأنه قلنا a lot of medication can cause bleeding, commonly like aspirin or heparin, ولا إذا عندهم history of significant trauma can explain this bleeding. Okay, so that's one. ما لقينا شيء, we go asking ourselves, is this a significant bleeding? ما يجي واحد بس simple bruising. And to be يعني objective, we use the score. هذا السكور اللي حطيناه بأول slide. Let's say they have significant bleeding and you'd like to investigate. Well, you start with the CBC to look for the platelet disorder as well as the coagulation profile, اللي هو PT and APTT. And you go from there. If wallahi they have abnormal platelet count, so you go here, you go to thrombocytopenia, and you start the workup for thrombocytopenia as we explained early on in one of the cases. How about if they have normal platelet count and normal platelet size and shape in blood smear? Well, you ask yourself, what their PT? Did they have a normal PT? Wallahi, if they have, let's say, yes, they have normal PT, you check for their APTT. If their APTT is abnormal, you may give them a trial of vitamin K and see whether it's corrected. If not corrected, you may actually do a factor 7 assay. So this is just على قولتهم a tree to approach any bleeding disorder, just to summarize all the cases actually we went through this lecture. Okay? طيب أحد عنده أي سؤال؟ I thought we're going to finish later on, بس أحد عنده أي سؤال about the bleeding disorder or how to approach it? أنتم ما زلتم موجودين؟ Anyone have any question, guys, about the coagulation, how to approach to bleeding? اوكي طيب اذا let's regroup. خلينا ناخذ كذا بريك ربع ساعه good break بعدين نتكلم عن الجي اي malignancy. اوكي so let's.
طيب دكتور معليش بس
سم
أثناء البريك هيكون التحضير هيفتح، فأنا بس حاب أنبه الشباب إنه هيفتح الساعة 10 هيقفل الساعة 10 و20 دقيقة.
اجل ممتاز اجل خلينا نقول 10 و20 نلتقي مجددا. ممتاز الله يعطيك العافيه.
الله يعافيك دكتور.
طيب let's meet in 20 minutes ها